position. I do like this, fix it. Okay, we don't use too big rods, but in any case here we have this system just pre-built it. We use this ring, 100. You may put it just connected between them, or if you're comfortable, you may put it one by one. But now, for save time, we do it this way. Yes, we put this system, this rod may be a little bit long. We change it. It's just aesthetic, I don't like it. Okay. Use the same length. Okay. We put here, we made maintain for now only 3 rods, because here, medial part, we put a half pin. Need to put this. Okay. Now we put them parallel. Okay, perfect. We start with olive wire, because the first wire, yeah, olive, no? Olive, yes. No, because the first wire, in this case, we start with the olive wire that goes through the fibula and tibia together, because in this way we fix that syndesmosis, distal syndesmosis between the fibula and tibia. Okay, we do like this. It will be parallel joint line, not so low, because if we need to do construction, we should have a much space here. Okay, this wire goes to fibula, tibia. You should stay enough posterior to catch the fibula. Like this. Okay. We attach this wire like this. Keep it. Okay. Like this. That's enough. I tie it here. This wire fixed. Okay. We tension this. Okay, we did this. After that, what we do, we proceed. We put stabilize another ring here. What we do, we put 2 posts, 2 whole post. no, a cube. We have it. Okay. Stabilize the proximal ring. Control that should be parallel to this system should be parallel to the distal part of the tibia. It is better. Right angle. Okay. After that, we put another wire, maybe olive wire 2, better, because this way we should stabilize the proximal or distal part of the tibia, and we put another wire with olive, but from the medial side. Like this. Only tibia in this case. Okay, bolt. Another bolt for fixes here. Yeah, cut this tip. Thank you. Yeah. Okay. Okay. We got this. Tension this. A really strong fixation. Okay, cut the tip and we bend the wire. Now, this way, we create a really, just a good fixator for the foot correction. If you want, you may put another wire and then a proximal ring or another half pin. It depends on you, but I think it's quite enough in the not so complicated correction. It is a good. We save time. Now, what we do, we shift to our preferred system. We attach our patient directly to the ring. Something happened with the phone. Okay, attach the patient. Okay. Respect the knee position. Put it supine, exactly supine position. Sì, adesso. Ok. A little bit more, yes, maybe. Okay. No, we change. Yes, okay, I understand you. We change it. Change here. No. Oh no. Where? How you want? Like this? Or there? Here? Yeah, but in any case, better that we see the foot.
We have to do that.
Yeah, because we don't need to see the tibia. Yeah, we works to the foot now. Okay. Okay. Excellent. Okay, fix it. Okay. Okay. Now it's stable system. It is always put the first row, another rod here. Because 3 it's not enough. 4 rods here. Nice. Okay. Tibia, it's okay. We put 4 rows. Like I said, you may put another wire here, but we don't do it. We save time. Now, a more important thing is we build the frame to the for the foot, and we start doing it with applying the wires on the calcaneus. What we see here that this is we do it like a closet way of the correction. Maybe we cut the bone at the end, but for now we have this equinovarus deformity and we start walking on the calcaneus. What we do, we put olive wires on the calcaneus because it is varus deformity. It means that the olive wires should go from the medial side to the lateral, because this way they push the calcaneus. We do it in this way. Crossing wires, try to find the good cortical bone on the calcaneus. One, another one. Usually at the foot I use only wires. Somebody prefer to put half pins, and I use half pins. Sometimes I use a Kirchner wire a little bit bigger, like a 2.5 Kirchner wire, but majority of the cases I use only wire. You see here that the position of my wire, repeat position of the varus deformity of the calcaneus. And now what we do, we should put the half ring. In this case, usually half ring that we put in the foot is a little bit smaller because we don't need too big size of the half ring. We do maybe 150, 140. We'll see now how it is. It's big enough. Okay, we use this. two rings, one half ring. One it will be for the calcaneus and another one it is for the forefoot. What I do, I should look it really good on the position of my calcaneus, and the position of this ring should be exactly perpendicular of the axis of the calcaneus. You should look from the bottom, and you should look from the lateral view. And what we do, we position it, the ring how I want. Like I said, you repeated position of the calcaneus, and after that, we start to attach the wire. Now we do this, maybe. One. We will need here too many hinges. We'll try to recover them. Okay. I'll fix here. And what I do here, I need to create the hinges here, and I use bolt for the attachment of the wire. Then I use a female post, for example, because you may use a female or male. In the case of the closet correction, you don't need to put high hinges, and usually I put the hinges at the level of the ring. I attach this female together with the wire because my wire goes in this hole, and it is comfortable for me to attach here. Okay. I look it for the position of my calcaneus. Okay, I put it, distributed the bone. Now I see if this is enough for correction of equinus or not. I position it like this. It's good enough. And I fix it another wire. Here, if the wire is a little bit inclined, what I do, I may bend it just a little bit with the instrument. And I attach it like this. Because it's all for comfortable work of you. This is all. Okay. Here from another part you see it is too high. I may do it in the same way because we have a long bolt with what I do, I bend just a little bit the wire and I put the bolt with the washer. I do sorry, high washer, maybe small washer or too high washer like this. And I attach it this way, because I may put the post, male post or female post, but this system with the washer is more compact. It is occupied less holes on my half ring. Okay. What I do now, I should tension my wire. Like I explained you before, I may do it in the two ways. The first one we use and another we use. Okay, this female wants to rotate it. What I do, I fix it in this way. My assistant, keep this rod, please. This way the female not rotated, and I tighten it really good. Just a little bit high, okay. Oh, escape, okay. Okay, now we may remove or we keep this rod now. Okay, we fix another part, another wire, olive part. Always when you attach the wire to the ring, just better to cut them, because if they are long, they give you many problems for working with the wrenches. Okay, I fixed another wire. Okay, and this system, I may do the tension by the wrenches like a Russian technique. I do like this because we don't need too much tension here. It's impossible to do too much. And we do it by the wrenches. Okay, one and another. Okay, we tension it. It's good enough. It's, you see, it's stable enough frame now. Okay, we should create now the particular system for correction of this deformity. What we do, we know that there's always biplanar deformity. If we need to create biplanar hinges in the foot, it is like a regular. Always we should have as much as possible freedom, and we always create these biplanar hinges. What I do, I put here one. It is one hinge is here. This hinge permits me correct the equinus deformity. And another hinge we create with this rod, another rod. It should be long enough because here now the distance is short, but when we do correction or maybe over-correction of the deformity, it should be long enough. Yes, we need another one because we'll should be three. Okay, what we do now, what I do, I put here, or better again, I start put this rod inside of the ring here. I see which hole it will be more adapted for this. I put here. I force a little bit because there is elasticity of soft tissue. When I insert the rod like this, I put like this, you see, now it is in a good position. I adapt it. I put another nut here. Unfortunately, in the foot, you can't create the frame that is good for all period of time of treatment, because in the beginning it's so deformed that you build one frame, but sometimes during the treatment you should modify it to do some adjustment of the direction of the rod and the system of correction. But the important thing is to have always biplanar hinges. Now we put this medial one. We did a little bit destruction, but we follow the elasticity of soft tissue. And what we do now we create the one lateral rod. We use always long rod, 150 in this case. I attach it female here. Sorry. A little bit of powder here. Another thing that we do, we should do the same system on the lateral side. What I do, I put Before I put a female, but here I may use male, like this. I attach this male here. I put it in the direction that this way, the hinges of correction of equinus, it will be the same like another one. This hinge and this hinge are the same now. Okay. Another hinge we should do for correction of varus valgus. I put another male here. And after that, I attach my rod here, like this. Now, when we finish to fix the first rod, it's possible to bend the wire, because the wires, it is disturbing me because they're too prominent here, and the risk of trauma. With this, bend them. I don't bend them in the beginning because the frame is not so stable, and you risk to mobilize the wires of the calcaneus. When we attach the ring, you may now bend the wires. Okay. Now we create another hinges here. Okay, you see how it is moved. There is all freedom of movement, but we put it like this posteriorly because it's more comfortable for me. And I found the hole where it is adapted to go, perpendicular of the distal ring. And now you see, we attach it. And this is a lateral rod. Other things that we should do, we should create the same system to the correction of the posterior pushing rod. What we do, we put here, for the simplification, we put another hinge here, male. It may be done in the foot, he stays like this in the foot, I may say, higher. Okay, touch it, don't stay firmly. We use the same length of the rod. In this way, we are not mistaken. Oh, in this frame and the foot, we need always many hinges. And if you don't have this here, we may find them everywhere. Yeah, maybe there. Mm-hmm. This posterior rod, it is particular a little bit because if there is a not so big equinus deformity, we may put it directly to the ring. But if it is not possible pushing, it is a too big deformity, to better to create biplanar hinges on the ring and another hinges for adapted of the equinus correction on the distal ring of the tibia. Now we do this job for better understanding. We create this. I use female here. Okay, I fixed all this post that attached to the half ring should be fixed strongly. Other stuff should be in a movement. What we do now, we do like this. We attach this rod here. Connect it like this. And this system create another biplanar hinges. Okay. Okay, we have enough length of the rope for correction. And here we should create the system for pushing this rod for correction of equinus deformity of the calcaneus. Like this. We put one like this. After that we may put another one, 2 holes, maybe 2 holes post, like this. And in the middle, yes, we may put this, female. Okay, give me one, maybe we change it just a little bit, put here. Because if not, this rod touch it to the Achilles tendon, we put it like this. Like this. We need small washer here. Okay, we start fixing the, because it's too unstable, we start fixing this nail to the ring. This never moves, it is stable. Okay, I do it strong. And here we touch this. This one, it's a little bit rigid. Okay, good. Put another knot there. Okay. Okay. Why we need this system so complicated here? Because if you put it directly to the ring during correction of this rod, correction of equinus, if the equinus is too big, what's happened? This ring displaces posteriorly, and this rod will be inclined. If you put this system with the hinges, you may prevent this inclination, and this rod will be not bended. It will be not difficult to turn this. Okay, this system for correction of the equinus of the calcaneus. Okay, we finish with the calcaneus. If you do osteotomy, in this case, if you should do osteotomy of the calcaneus or the midfoot, what we do in the beginning, we fix the talus. The talus, we may fix it with the half pin on the wire, and this half pin will be attached to the proximal ring. But this we do only if there is a rigidity or subankylosis of the ankle joint. In this case, we consider that there is not ankylosis, it is only deformity at the level of the joints. What we may do now we fix it calcaneus, we may remove the screw. If not, later it will be difficult to do. We need these instruments. We remove the screws. Yeah, they're long. That's quite. It will be nice to do it with the motor, but we don't have it. Okay, this system for doing this. Okay. One we did. Oh, so long. Oh my God. So nice. I bring it home. Another one. Long enough. It's a good system, stable. Okay, a little bit of patience. We need to remove this. Wow, so long screw. 1 kilometer screw. Fantastic. Okay, we did it. Now, like you see, this system just permits us to correct the deformity of calcaneus, everything. But we do it later when we connect all of the system and we start doing correction all together. Okay. What we do now? Now we should fix the forefoot with this another half ring. We prepare always olive wires. One and another. Okay. Yes, usually we fix it metatarsal bone. The first wire goes from the base of fifth metatarsal, and this area, base of metatarsals, is large, and with one wire like this, you may catch all of them. From the fifth to first, it goes oblique, a little bit from posterior to anterior, and a little bit from the distal to the proximal. And this way we catch all of them. Another wire that will go from medial part to the lateral. And here you may catch maybe not of them. We will see now how it is elastic, this foot. And always a little bit oblique. The olive remained in the first metatarsal. Okay. No, not so good. Just the direction difficult. Okay. This foot elastic enough. And we catch all of them. Okay. And like you see, the wires that goes, it's not perpendicular of the axis of the forefoot. But I don't want the perpendicular. because it's not important for me, because the foot always deformed. The important thing that we should put the half ring exactly perpendicular to the forefoot. For this reason, what we do, we attach this wire differently, not like usually we do it for the tibia or for the femur, not perpendicular, parallel to the wire or half, but we adapted the direction of the wire of our ring like this. One here. Not. Another one we attach here. This is quite straight, but not so much. I bend it too. Okay. Just a little bit more than enough, but if you do overcorrection, it's better. But okay, I use one washer to adapt it. Okay. Connect like this. Okay. Now it's connected this way. It's a good overcorrection. If you look at it, it's quite perpendicular, but just a little bit more. But better to have a little bit more. Here, this wire, proximal wire, it says in any case, we don't need to push the wire too much, olive wire, if they don't touch the metatarsal, it is better, because if not, if you do the olive wire pushing too much from one side or from another side, you may squeeze the metatarsal. Better to leave a little bit space. What we do here, we attach another one here. If it's long enough, we do like this. If it's not long enough, we put the washer again. Here, for comfortability, we may put the nut, this millimetrical precious nut. Here we attach with bolt. Okay, if you look at the lateral view, it should be perpendicular of the axis of forefoot, because in this help you to orient it how it will be the position of the forefoot after correction. Like this. Attach here. And the other one, it is medial part. We attach in this way with two male posts. And here we attach it with a bolt. Okay, perfect. What we do now, we should put in the tension both of this wire. What I do, I don't do tension from one part or leave another part or leave, because like I said you before, I want to prevent the squeeze the metatarsal. And what I do, I fixed, in this case, both wire on the medial side. Okay, this olive medial. Another wire, olive lateral, but I fix it here, the same. Okay. And after that, I do the tension of the wire. Like here, I said you before, I do them maybe like Russian style. Do the tension in this way. One. And another one. Okay, it's tension enough, and we have now stable frame on the forefoot. And cut like this. Never cut too short, but now for save time I did it. Okay, now you see this frame on the forefoot is stable. What I should do, I give the advice to my assistant how to do the hinges, but now I shift to the position of my assistant, and what I do, I should create again the hinges for the correction of the forefoot. What I do, I put here maybe male like this. I attach it, and like I said you before, the first regular, this post that are going to connect to do the connection with the half ring should be fixed immediately, strongly, because there is no hinges here. It's fixed, no movement here. And again, we create the double hinge. We use the female attached to the ring, to the rod. Another male we put here. It is hinge for correction equinus of the forefoot, and this hinge for correction of abduction of the forefoot. Okay, now we create this. Before we leave again stable the calcaneus. And what we should looking for, we should see how this rod directed, because this rod should respect the direction of the plantar superficial of the foot. I put it like this, and now I should create the pushing forces in this rod. What I do, I adapt it to my position. I put again 1, 2 hole post, for example. Okay, and after that I want 1 whole cube, for example, because I find it's more comfortable for me to correct it with the cube, and because the cube is a good volume and it's sliding good inside the rod of this cube. Okay, now we do this attachment. I use a small bolt with the washer. We need always use the washer, because if the bolt touching the cube inside too much, what's happened, that it may block the rod, movement of the rod inside of the cube. Okay, now we do like this. Because it was blocked too much, this bolt. When the small bolt touched the half pin, it became broken, and you can't utilize it more. Better to use new one. Okay, I put the bolt, put the nut, and like you see here, we create a pushing rod on the medial side. And here, if you understand it better, this is the same, always biplanar hinge, because one hinge is here, it permits me to do the correction of the forefoot. Another hinge is here, when I touch the two posts here, because it permits me to do the correction of the abduction and adduction of the forefoot. Okay, I return it back to my position, and It is only closed way of correction. I don't need to do, in this case, the medial rod or lateral rod the same way because there is not so big tension. I do only medial correction because it's varus deformity. But the really important things to create another system for correction of abduction, supination of the forefoot, and correction of equinus of the forefoot. What we use here, usually we have a special plate. We need a long plate here. And now we create it oppositely. And now, what we do? Because I call it this system, we call it we call it the system a T-shaped plate, but usually there is a twisted plate. I think you will have it in the twisted plate. You say have twisted plate? Maybe in the set or somewhere. It's twisted like this. Remember. Oh. Oh yes, optimal. Okay, there is a twisted plate because it's my preferred. Okay. Because it's particularly, like you see the plate is rotated at 90 degrees, and this permits me to attach it and use it for correction of the forefoot. What I create here, I should create one axis of rotation, and this axis of rotation should be plus or minus positioned of the level of the base of the fifth metatarsal. Here what I do, I put here, this hole. I attach this twisted plate. Okay, the direction of this twisted plate, it should be exactly perpendicular to the anterior half ring of the foot here. If you look it from this, from my direction, like I look it to the half ring anteriorly, and I look to my plate, it is a perpendicular direction of both of them. Later, when you see this frame, you understand what I mean. After that, in the end of this twisted plate, we put the system that create the letters T between them. What I do here, I put here one male and one female, the same size, maybe better. Like you see here, this I put 3-hole male or 3-hole female. I squeeze between them because they're stable like this, but better if they have more movement because they should move than this hinge, is create the hinge. Another thing we need here, we need a long rod, probably 150, it will be enough. No, this is good. And another one, we need 200. Okay. What I do, just a little bit more. Okay. I do like this. I do. No, the plate is perpendicular of this, of the distal ring or half ring of the forefoot. This. No, this is, yes, before I said it will be a little bit overcorrected, but the twisted plate, it should position perpendicular of this one. Okay, we attach this like this. Okay, I put this vertical rod, one. I attach this to the half ring. We use here or one female post or two whole female. And now we'll look it for them. This is safe for attachment because, like we explained you before, that we need many small pieces if you want to do the surgery of the foot. If you don't have them, better don't do nothing. You don't do surgery of the foot. Okay, what we do now, we attach this. We use 2 hole posts for attachment of the forefoot and 1 hole here to allow. Okay. After that, I do connection with my forefoot ring, forefoot half ring. Like this. And like this. And connect it. Like this. Connect it. And the last step we do this. We connect this to another part of this T model system. And here we have another female post, this one. We connect them like this. Connect like this. Then we attach it to the distal ring. A little bit too much space. Okay, we may do like this. If it's too much in the beginning, I may put here. This way it became parallel. Because like I said you before, we always do this frame, but we never knows. No, we always knows that you should be changed it a little bit during treatment. Yeah. It's small bolt, no function more. Because we use them many times, this short bolt for the fixing of the half pin, but when we fix the half pin, this bolt no function more. Okay, we attach this. Okay, now we do this. When we do this construction of the T model, what we should achieve here with we follow elasticity of the foot a little bit, position of the plate and everything like this, but we need to adjust the frame in the way that these 2 rods should be parallel. And this is really helpful to understand how the correction will be done. Okay, they are plus minus parallel. Okay, we put them. Now as deformity is rigid, when we do osteotomy, it will be easy to manipulate because it's, my foot is really rigid now. And what we do again, the last step that we do, it's a really important step, that we should create another system that manipulate my T model. Okay. What I do here, I need one female again. This is a 3-hole female. Oh no, that's okay. Oh no, we use another system. Like this. This system, this rod, it is a system that controls the movement of this twisted plate. Okay, I put this female again. What should I use here? We have another plate that is, it's called curve plate. We see here, yes? Because this plate, particular one, have a particular angle here, and this plate may be fixed of the half ring, and it's not this plate don't have possibility to move on the ring because the border of the plate touches the ring, and this plate don't move. If you put this normal plate here, this plate may change angulation, but we don't need this element to move. Okay, maybe it's too near. Too near here, we put here. Okay. Okay, I put it in the maximum position like it possible to put. Here, my rod with a female, it's here. And what I do now, okay, I put it too near, change again. Because we need a little bit more space on the rod. We put it near. Okay, like this. Because I need to do distraction here. And what I do, I put this rod here. Maybe again with a washer in this way to slide in better. Like this. And here in the this twisted plate or this curved plate, I put the female again with a small bolt. Just a little bit short here. Okay, bolt. With washer? Yes, better with washer. Need one more nut. Here I need a little bit longer bolt. I don't remember if I see it. This two centimeters. In this way I may put another washer, a long one, because it should be parallel. I do like this, just a little bit, we need to like this, okay. No, it's okay, I push this small washer, it will be enough. I know you have a long bolt, I know, yes. Here, okay, give me one, it will be nice to use everything. We have a 3 centimeters bolt because we need to put 2 washer and we don't have a space with a small bolt normal, and this way it's perfect. You see, like this, we fix it, and this system permits me command this T-model. Now practically we finish the frame. For the closet correction, we don't need to fix the talus, we don't need to fix other things, but if you want to see how this moves, you need to cut the bone. We cut the bone, and mid shaft, because the calcaneus we move together with the talus, but the midfoot, it will be difficult to understand how it is function. And I do the cutting. In this case, I cut it here, maybe in the level of the shopper joint, plus minus. Cut the bone, and I should notice, and I recommend always to fix in the tooth, because if there is a deformity of the foot, this always accompanied with the deformity of the tooth. And if the tooth is elastic in the beginning, there is no flexion contracture. But when you start correction of the foot, the tooth go into the claw foot deformity. For this reason, better to prevent this, we put all the tools, we put Kirchner wires that goes inside of metatarsal, or it maybe go superior-ostal. It's not important. Important to fix it this, and after that we bend them and we attach to the ring of forefoot. Okay, now I did osteotomy. In the way you may understand how the frame will be function. What we do now, we do correction simultaneously of all the deformity. We have equinus, a position of a calcaneus, varus deformity of the calcaneus, and we have abduction of the forefoot. We have equinus position of the forefoot, and we do it together. How it follow? I do correction of the calcaneus, I release this rod, medial rod, and slowly the patient do distraction here. Like you see, we do distraction, this rod. Simultaneously, the patient of the same rhythm, we put this direction. The patient do shortening of the lateral rod, like you see here, quite automatically. All these hinges here function simultaneously. You never tight the rod, these hinges. If you tight one hinge, it is blocked all the correction. All the hinges here by planar hinge should be always free. You see now, we short this rod. Simultaneously, we do lengthening of the posterior rod. We correct the equinus of the calcaneus like this. Again, you see. Again, I do correction here. And now, like you see later, it was displaced, but now the talus in the right position. Okay, we stop a little bit. Later I'll show you what we need to change, because when we do a big inclination and sometimes of correction, some point of correction, the rows should start bended, and we need to change it. And now I show you the same, because like you see, we accompanied correction of a calcaneus, but it should be accompanied of correction of the forefoot. What I do, simultaneously we do shortening of these two rods like this. Okay, all of them go together. Simultaneously I do lengthening of this medial rod. We do lengthening, and this permits me correction of abduction. Slowly. Okay, these two hinges, it moves. They always free, because you see now it was blocked, the one this, and I can't move it and translate it. Now I do it with a big freedom, like this. Okay, we did this. And we continue with this rod again. But allow, if you're attent, pay attention here. What has happened now, like I showed you before, that these two rods, they was parallel before, but now not parallel, because we do the destruction of this rod, and this anterior medial part of the half ring goes forward. What we should do here, for correction of abduction, we should move this T-model. What I do, I release here, I release just a little bit the plate on the ring, distal ring, I release here because all this system should be in the movement. What I do destruction here, and this permits me manipulate of this T-model. It goes in this direction laterally. All these hinges moves. All these hinges move. This should be free. This is free because all these hinges permits me correction. Now I move this T-model like this, and what you see, this rod became again parallel. And if I need the over correction, because if I do closed correction of the foot, I may do it more and more, but it should be done simultaneously of lengthening of this rod, and they works together, one and another simultaneously, achieve this kind of correction progressively. Okay, we do this. Now what you see, if you want, correct again the equinus deformity of the forefoot, you release this. We do compression of these two rods, slowly, more and more. And like you see now, we correct the forefoot adduction. Now I did too much with this, probably. Okay, we put like this. Okay, these two rods always remain parallel. And we achieve, you see, correction of equinus. Okay. Now, obviously, this foot is not stable, but the foot have many ligaments, they connected between them, and we fix it a little bit in the way that it's not so freedom. Okay. And another thing, if you want to do, it remain a supination for the forefoot, you may do more faster compression here on lateral side like this. You see how this moves. We do more compression here, and we achieve correction of supination. The foot became pronated. Okay, like this. Now I fix it, all this system, because if not, it's so mobile because of lack of ligaments. I tied all the nut, all this system, and you see, I demonstrate you that now the foot is completely plantigrade, perfect position, quite flat foot, but what we need to do is we achieve it. And if you look to my osteotomy I did here, it is, we create the cuneiform destruction regenerate at the level of osteotomy. The same happened in the calcaneus. I didn't cut the calcaneus because we don't fix the talus. But if we do osteotomy of calcaneus, we fix the talus and we do the same procedure with this frame. When we do osteotomy, there's much big tension of the soft tissue, and I put another plantar rod. This plantar rod we keep the same distance, or we do sometimes shorten it, but frequently you need only to maintain the distance laterally, because if you don't do this, it will be shortening and osteotomy will heal. This is our frame, and this is finish of our job on the foot.